today, it's all going to be up to the point that we're 3 years out, and then we as a state start picking up 10%. Up to that point, it's all going to be picked up by the federal government, the cost of it, right? Okay, and that's a philosophical thing because federal taxes, I'm sure, would probably eventually go up. One last question on the $12 an hour that the guys are being paid for the company, for lack of a better term, that's being given the contract, and then they go out and they get their people to go out in their respected area, their territory, and sign up. If they're paying the employee $12 an hour, what's the profit margin between the $12 an hour and the contract? Can you help me get a grasp on that? Are they given a block grant and then they have to hire so many people, or can you explain that a little bit?
They get an all-inclusive rate per guide, and it's around $36,477. I can look up the exact amount. That includes an estimated $12 an hour full-time, 25% fringe, 20% overhead, which includes equipment service, like a web service, their cell phones, their supplies, and there is money built in for travel for the employee. So the all-inclusive rate per guide is how the contract goes, and it was built based on some fringe, some overhead, some travel, and the $12 an hour plus an hour and a half per week supervision at $16.50 an hour. So those were the factors that went into the rate.
Where can we get a breakout of that, or where could we see there? Could you email that to me if you don't mind?
I'll be happy to email it to you, have it broken down.
Okay.
And all the entities have it.
Okay, and one last question. The number of people that we're expecting to sign up on Medicaid, did those numbers include how the business world is reacting to this, to the Senator's representative questions a while ago? Did the numbers anticipate that businesses are in the process of lowering their employees to below 30 hours a week, and that thus is shifting it to the Medicaid coverage in order to avoid that penalty? Did the numbers that we were given have any of that reflected in them?
I believe they did anticipate some market share. I don't have the number in front of me.
Okay, but so those numbers we've been hearing tossed around, about 300-something thousand, had a percentage that anticipated that. Okay, and I'd just like to be kept in the loop on that one as far as if those numbers shift up high.
I would say you're on the mark. That is one of the least certain numbers that we have in the entire Affordable Care Act
scenario.
But just to be clear, I mean, an employer reducing hours would not shift to cover an employee to Medicaid. It might shift with the exchange, and therefore eligible for a subsidy, depending on their FPL, the employee, or to a penalty. But that traditional Medicaid enrollment, because we have no working age adult at all, regardless of FPL, eligible for traditional Medicaid, that won't affect that number.
Create a whole new scenario of problems because there are people there having to go out and get a second part-time job, or they are going to end up having to apply for other benefits because now they can't make the living that they used to make. So I'm curious what the spin-off of that's going to be with regards to other areas of our government, like food stamps and other benefits. Is there anything in place just to kind of monitor that to see what the spin-off effect is going to be?
I don't think we have anything specifically in place. I'm sure there'll be national groups, and I think this is a good point here. So Burris has mentioned before. That really, to the degree that happens, it's really because of the Affordable Care Act. It's not because of the private option.
All right, we were able to protect employers with employees 138